want to talk about symptom modification procedures. So Lewis and colleagues identified this. It's an alternative method of treatment-based clinical exam. In this paper, he described a series of 4 mechanical techniques that are applied when the patient performs an activity or movement that closely resembles their symptoms. And this was in discussion with humeral scapular, cervical thoracic, and thoracic tests. And they identified symptom modification procedures can be used to guide treatment. As a patient went into a proper position that generated pain, the therapist would either provide a manual passive correction or have the patient provide a movement correction to optimize movement and decrease pain. Symptom modification procedures are also used in different models. The MSI model, the Movement System Impairments model by Shirley Sarman and colleagues, also uses these, and we'll discuss this in more in-depth detail throughout the course. But I just want to introduce you to the concept. A patient performs a movement. It's suboptimal. It generates pain. The therapist comes in, they make a change. Either cue the patient passively, or have the patient actively do the change, and the patient increases range of motion, increases strength, or decreases pain. These are symptom modification procedures. As you can see on the slide here, we have this example. We have a movement fault, you can see on the far left, lumbar flexion with inadequate hip flexion, inadequate anterior rotation of the pelvis. We then have an active symptom modification procedure. The patient bends forward to touch their toes. They flex their knees. They then get adequate motion in the proper regions. We then have a passive symptom modification procedure. The patient flexes forward. The therapist comes in and adds that anterior rotation of the pelvis to improve motion through the hip. So we have our movement fault, our active symptom modification procedure, and our passive symptom modification procedure.